As a heart failure patient who was diagnosed over 20 years ago, I still remember the feeling of that initial diagnosis. Those words, heart failure, are terrifying. Today, I sit down with Dr. Tamara Horwich of UCLA. She specializes in heart failure, and she also is doing cutting edge research when it comes to stress hormones and heart disease. I hope you enjoy my conversation with Dr. Tamara Horwich of UCLA. You're doing cutting edge research around stress hormones and heart disease. Can you tell us more?
Chronic stress definitely has a strong association with the development of heart disease over time. Also, like acute stress can be associated with a cardiac event.
What is the correlation between stress hormones and heart disease?
There is definitely a correlation between chronic stress levels and the development of coronary artery disease over the long term. Furthermore, there's also an association between having an acute stressful event and at that time having a cardiac event.
Can you tell me about broken heart syndrome?
Broken heart syndrome has been called Takotsubo cardiomyopathy, stress cardiomyopathy, and basically it's kind of a disease entity that occurs mostly in postmenopausal women. What happens is the woman has a stressor in her life. It can be any kind of stressor. It could be like finding out a loved one has died, or finding out, one example that I remember from when I was training in cardiology, finding out your husband is cheating on you, having a medical procedure, getting into an argument with your boss at work. And what happens is the woman has chest pain, shortness of breath, feels like she's having a heart attack, and often goes to the emergency room, rightly so. And what we find out is that it's not a true heart attack in that there's not a clot in the coronary arteries when we do an angiogram and look at the arteries. What happens is we call it the apical ballooning syndrome. At the whole apex of the heart, kind of like the bottom half or bottom third of the heart, isn't working and is ballooning out. And when we've done research on this, basically it's thought to be a surge of stress hormones affecting the heart. And obviously it's more complex than that, and there's an interplay of factors. It may be that in these postmenopausal women, the lack of estrogen is playing a role, as well as microvascular disease. So perhaps another kind of etiology of heart disease as women age is diseases of the tiny vessels of the heart. And these may play a role in all sorts of heart diseases which affect women, including this stress cardiomyopathy or broken heart syndrome.
What is the difference between a heart attack and a panic attack?
People use the word to describe many different, syndromes, but mainly what we're thinking of when we say heart attack is that one of the arteries leading to the, that gives blood flow to the heart, which keeps the heart nourished, the heart muscle, is clogged, and the heart is not getting enough blood. And that is basically a heart attack. And so it could be temporary, like the heart's not getting enough blood and we can restore that. Sometimes the heart muscle dies in a certain portion, and mainly the person is feeling symptoms of chest pain, shortness of breath. They could feel anxiety. They could have, diaphoresis, which is, sweatiness. And a panic attack can have very, very similar symptoms. Sometimes people don't realize that's what's going on, and they're experiencing shortness of breath, possibly pressure on their chest, sweatiness, very similar symptoms. But the important difference is they're not having a lack of blood flow to their heart. So their heart, isn't acutely in danger. Now, the only way that a person can know, what they're having, if they've never experienced one or the other before, is to be checked out by a doctor, having an EKG, having blood tests. So if there's any question, you go straight to the emergency room or a place like an emergency room. But the key difference is panic attack is not involving the heart, even though it may feel like it is.
I have so many patients in my support group, and myself included, that are given that diagnosis of heart failure, and it's scary, it's terrifying. Is heart failure really a death sentence?
No, it's a terrible word. Heart failure, again, runs the gamut from somebody who feels short of breath like once in a while, and maybe their heart is just a little bit stiff, all the way to a heart which is, only pumping 10% of what it should be pumping. But that's a huge gamut. Fortunately, like our guidelines, by the American Heart Association, American College of Cardiology, still use this word heart failure, which is why originally when we had that clinic that you came to, I believe we called it the Cardiomyopathy clinic because it sounds a little better than heart failure. And I agree with you. I think as a community, maybe we need to come up with a better word because, for example, a type of heart failure, which is common in older women, is called heart failure with preserved ejection fraction, and it can be pretty common. We call it HFpEF. It's the heart gets stiffer with age, and so it means that sometimes they can accumulate a little bit of fluid, like in their legs, or feel slightly short of breath and may need to work on getting their blood pressure down, being on a diuretic. But it's definitely not even close to a death sentence, something you live with the rest of your life and treat with a cardiologist. So 100% it's not a death sentence. Now, even when we have heart failure with reduced ejection fraction, which meaning the pumping capacity of the heart is decreased, is down, that still isn't a death sentence. I've had patients who have a low ejection fraction, meaning their heart's not pumping well, and we have amazing medicines, which I know when I saw you, and I'm telling you, there's more medicines available now than there were back then, and other interventions, which can restore the heart back to its original function. And, patients can go on and live their life. So even patients, for example, with a genetic defect that causes them to have a weak heart, I've seen their heart be restored to its full capacity with medications and other therapies.
What do you think of the word heartquake? Does it elicit anything in you?
Yes, I think a heartquake could mean several things, but most importantly, if there's a heart event, no matter whether it's, a tiny run of tachycardia, which is maybe benign but feels very scary, or it's all the way up to having a heart attack. It's a significant event that's affecting a woman's heart. It causes a change in the way that woman perceives her health, perhaps perceives the world, and maybe consequently a change in lifestyle, change in thinking, and change in the way she cares for herself and others. And so that's how I would interpret heartquake.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart healthy living. And remember, wellness starts with the heart.